I'm Dr. Kavipriya Soma, working at Athena Women's Clinic, Bentley, Western Australia. I am a GP, former GP Obstetrician, mainly now serving women and children. Of course, we don't say no to men, but that's just my focus, mainly focusing on reproductive health and pelvic health. I moved to Australia in 2007 to a small remote town in Tasmania called Queenstown. Most people think it's in New Zealand. Actually, there's a Queenstown in Tasmania. So I started as a GP there, worked there for 18 months, and I got the opportunity to move to Perth at that point in time. And a chance meeting with another GP obstetrician just opened up the opportunity. I have been trained as an obstetrician and gynecologist from India. I did not want that qualifications to go waste. So I thought, okay, here is an opportunity as a GP. Combining my obstetric skills was the best thing I could ever come across. So I practiced that up until 2016 when the Bentley Maternity unit had to close because of COVID. When the COVID lockdown hit and the maternity unit closed in Bentley Hospital, I set up my own clinic in Bentley called Athena Women's Clinic, focusing mainly on providing services to women, offering them a safe space where they can talk about the private health issues that sometimes is difficult to talk in a general practice. It is by no means breaking down the continuity of care, but offering them a safer and a private option that the women can still have. And yes, lockdown was tough, but I survived, and here we are 5 to 6 years later, still going on, continuing to provide the same safe space for women to come and have consultations. About 50% of working population is contributed to by the female population, and majority of that women are in the reproductive age group or in the perimenopause and menopause age group. So luckily for us, menopause is gaining momentum. More and more women are becoming more aware of the symptoms that contribute menopause. There is been talk about this particular issue, which is the genitourinary syndrome of menopause. Although that is mainly focused on the mucosal aspect or vaginal mucosal aspect, there is very little talk about the pelvic floor per se. We all know what pelvic floor is. So these are a group of muscles that work like a hammock that holds the bladder, uterus, and the rectum and helps with reducing or controlling the incontinence. So if there is pelvic floor weakness, then obviously the woman ends up having urinary incontinence, which can be combination of stress and urge incontinence, or there can be prolapse. The organs, the uterus can come down, going from varying degrees, which can cause significant distress to the woman. This obviously causes work absenteeism as well as the medical expenses. Now, there's a lot of women who do struggle with this, but they end up using just incontinence products. Unfortunately, there's not a lot of options that are available that are not discussed or not aware of. I would like to share one of my patients' journey. So this is a 67-year-old lady who is traveling about 4 hours away from Perth, who has to travel to Perth to get any medical treatments or access any medical treatments. Now, just considering the journey itself. So, for example, she has to start at her house. So she has to empty her bladder. She gets to the local airport. She looks for the toilets, empties her bladder, and then she gets on the plane. Again, one more visit to the toilet. Then when she gets off at Perth Airport, another visit to the toilet. And then from Perth Airport to our clinic, the first thing she does is goes to the toilet. So that's, you can count how many toilet visits that is. Not only distressing physically, emotionally, she has to look for toilets everywhere she goes. And that's something that's been bothersome for her. The second issue that she was facing along with this is painful intercourse. And she said that has been interfering with her relationship. And both partners have a great relationship, and this was beginning to ruin that relationship, and she was beginning to get worried. That's when she's sought treatments other than conservative management, which is usually, local vaginal estrogen creams or physiotherapy or using incontinence products. The symptoms that a woman can experience because of pelvic floor weakness may start with urinary incontinence, which is a mixture of stress and urge incontinence. There can be pelvic organ prolapse. Combined with that, there can be vaginal mucosal dryness, recurrent urinary tract infections. The general treatment options that are available, depending on which symptom is predominant, that would be physiotherapy, local vaginal estrogen creams, or there are newer treatments like vaginal pessaries that are available to help with the dryness and improve the libido. But when it comes to urinary incontinence, it's mainly physiotherapy, where they teach you the Kegels exercises to do it appropriately. Sometimes a woman may require something called a pessary. So a pessary is something that supports, a device that supports the vagina as well as the cervix, so it stays in place and the bladder wall is lifted, so the symptoms are alleviated. Apart from this, if the condition is really severe, then surgical intervention by specialist gynecologist or urogynecologist is definitely the way to go. But there are some minimally invasive treatments that are available. A bit about high-dose platelet-rich plasma therapy. Everybody must be aware of this because it's widely used in skin and hair therapy, but it is also available to be used in the pelvic floor weakness. So the important thing is that it is autologous sample. What that means is the patient's blood is taken, spun twice, and 10 billion platelets are isolated and injected into the pelvic floor area, of course, through the vagina. So the sessions are important, and it is important that the woman completes the 3 recommended sessions to get optimal outcomes. There are about 614 studies that's available worldwide for us to refer back to, out of which there are 14 Cochrane reviews which have said that this high-dose PRP therapy or platelet-rich plasma therapy is helpful for these symptoms. The second therapy that is available is the electrical muscle stimulation therapy, which is very similar to a TENS machine. So a small probe is inserted into the vagina, which delivers 72,000 pulses over 30 minutes. So it's like a boot camp for the pelvic floor muscles. This is a TGA approved therapy that is available in Australia and that has got proven efficacy in terms of symptom relief. There are many who still struggle with these symptoms, but like I said, resort to continence products, and there people are happy to use like continence pads or continence underwear. But this kind of awareness, where the minimally invasive outpatient therapies that are available are not being explained to the patients or the medical community, so it would be worthwhile looking into these options for both medical professional as well as the general population to become more aware of the availability of these options.